So let me ask you something. When was your last blood test? And more importantly, did your doctor look at all the right markers? Because here's the shocking truth. The standard lipid panel you're getting is missing some of the most critical warning signs of heart disease. So listen carefully, because what I'm about to share could literally save your life. In the next 10 minutes, I'm going to reveal 5 critical cardiovascular markers that most doctors never test for. These aren't your basic cholesterol numbers. We're talking about advanced markers that could spot heart problems years before a standard test. And here's the kicker. These tests are available right now, but chances are your doctor hasn't ordered them. Why? Because most healthcare providers aren't up to date with these cutting-edge markers. So if you want to truly understand your heart health risks, not just guess at them, stay tuned. This information could be the difference between life and death. So let's dive in. Traditional cardiovascular testing typically focuses on total cholesterol, HDL, triglyceride, blood pressure, but these tell only part of the story. They miss critical markers that could indicate cardiovascular problems long before traditional tests show any issues. So marker number 1, LPPLA2, stands for lipoprotein-associated phospholipase A2, also known as the PLAC test, the plaque test. And here's why it's so crucial. It specifically indicates inflammation in your arterial walls. High levels suggest unstable plaque that could rupture, more predictive of heart attack risk than standard cholesterol test. And optimal levels should be actually below 200 nanograms per milliliter. Anything over 235 nanograms per milliliter indicates very high risk. And studies show people with elevated LPPLA2 have 2 times higher risk of coronary heart disease. One patient reported reducing levels from 280 to 175 nanograms per milliliter through specialized anti-inflammatory diet, high dose of fish oil, we're talking 4 grams EPA DHA daily, aged garlic extract 1200 milligrams daily, pomegranate extract 1000 milligrams daily, and hawthorn extract 1500 milligrams. Marker number 2, myeloperoxidase, short for MPO. This is an enzyme that could be destroying your arteries right now without you knowing it. Why MPO actually matters? Well, it indicates active inflammation inside artery walls, predicts risk of future cardiovascular events, can be elevated even with normal cholesterol levels. Optimal levels should be below 470 millimolar per liter. Now, over 670 indicates very high risk. Now, multiple cases of people lowering MPO through nanocurcumin supplementation, 1500 milligrams daily, NAC, N-acetyl-L-cysteine, 1200 milligrams 3 times daily, green tea extract, 500 milligrams of EGCG daily, and of course, regular exercise, specifically high-intensity interval training. Marker number 3, oxidized LDL, also known for OXLDL. This is not just your regular LDL cholesterol. And key points, measures damaged cholesterol particles, more predictive of arterial plaque than standard LDL, direct indicator of cardiovascular aging, and optimal levels should be below 60. Anything above 80 indicates increased risk. Now here's a protocol for lowering OXLDL. Documented cases of 30 to 40% reduction through astaxanthin, 12 milligrams daily, mixed tocotrienol such as vitamin E, 200 milligrams daily, bergamot extract, 1000 milligrams daily, and time-restricted eating, a 16-8 window fasting with low-carb intake. Marker number 4, homocysteine. Now, this amino acid could be silently damaging your arteries, and most important, independent risk factor for heart disease. It does indicate methylation status, links to both heart and brain health, and optimal levels should actually be between 7 and 9. That's it. Anything over 10 indicates high risk. And here are some success protocols that I can share with you. Methylated B vitamins such as B6, B12, methylfolate, TMG such as trimethylglycine up to 1,000 milligrams daily, proper zinc levels 30 milligrams daily, and make sure you're avoiding folic acid blockers. Marker number 5, small dense LDL. See, not all LDL is actually created equal. These small particles are the most dangerous. Why it matters? Well, its most atherogenic form of cholesterol can actually slip into arterial walls easily, as standard lipid panels miss this completely. Optimal levels should be below 500 nanomoles per liter. Over 1,000 indicates very high risk. Now, proven reduction strategies. Documented cases of 40 to 60% reduction through Mediterranean ketogenic diet or carnivore diet, berberine 1500 milligrams daily, citrus bergamot 1000 milligrams daily, and regular resistant training at least 3 times weekly. So let's recap these 5 critical markers, and please do grab a pen and paper and write the information down and share it with a friend or even a family member. You could literally change their life. And if my videos have made a difference for you in even the tiniest way, consider throwing a buck or two my way. That'll help me keep making educational videos and doing more self-testing. So number 1, LPPLA2 for arterial inflammation. Number 2, MPO for active arterial damage. Oxidized LDL for cholesterol quality. Homocysteine for methylation status. And number 5, small dense LDL for particle size risk. So that said, here is your action plan. Request these specific tests from your healthcare provider. If they don't order them, seek out a functional medicine practitioner. Use the protocols discussed to optimize your levels. Retest 3 to 6 months to track progress. Now remember, standard blood tests aren't enough. These markers could reveal hidden cardiovascular risk years before traditional tests show any problems. So guys, if you find this information valuable, give this video a thumbs up and share it with someone who needs to hear this. Don't forget to subscribe for more cutting-edge health information. So until next time, this is Maurice reminding you that knowledge is power, especially when it comes to your heart health. So stay informed, stay healthy.